Your doctor says one word, biopsy, and suddenly your mind does what it does best. It jumps straight to the worst case ending. But here's the plot twist most men don't hear in the exam room. Biopsy isn't one single procedure. There are different biopsy routes, different targeting methods, and those differences can affect comfort, infection risk, and even what gets found. Let me put it like this. If your prostate biopsy is a mission, then picking the wrong method is like using a paper map in a GPS world and then wondering why you ended up in a ditch. Some approaches pass the needle through an area that naturally contains bacteria, so infection prevention becomes a real conversation. Other approaches avoid that path entirely. And if you've already had a negative biopsy but your PSA keeps rising, choosing the right strategy matters even more. And I know what you're thinking. Wait, are you telling me I might be walking into a procedure without knowing there are options? Yes, this happens all the time. So in the next 10 minutes, I'm going to explain TRUS versus MRI, fusion versus transperineal biopsy so clearly that you'll be able to ask your doctor the right questions in one visit without sounding like you got your medical degree from the comments section. Quick note, education only, not medical advice. Now let's decode the biopsy options.
Thanks for watching. Stay informed, stay calm. Subscribe for calm, evidence-based health here on Nourish Today.
Before we compare the 3 biopsy options, we need to fix one big misunderstanding. People talk about TRUS, MRI Fusion, and Transperineal like they're 3 totally separate procedures. In reality, they're more like building blocks. 2 variables shape your biopsy: the route, how the needle gets to the prostate, and the targeting method, how the doctor aims the needle. Route is the doorway you use to enter the house. Targeting is whether you have the right address and a good map. You can enter through a front door or a side door, but if you don't know which room you're looking for, you might still end up wandering. There are 2 main routes. One is the transrectal route, where the needle passes through the rectal wall into the prostate. The other is the transperineal route, where the needle passes through the skin between the scrotum and rectum into the prostate.
As you can see on the tablet,
Then, there are 2 main targeting approaches.
We discussed.
Systematic biopsy samples, standard zones in a structured pattern. MRI targeted biopsy uses an MRI done first to identify suspicious areas, then targets those areas during biopsy, often using MRI Fusion software that overlays MRI information onto real-time ultrasound. Here's the key. MRI Fusion is not a route. MRI Fusion is a targeting method. Depending on the clinic, it can be done with a transrectal route or a transperineal route. So when you hear biopsy, don't think of one single procedure. Think route plus targeting. Now let's start with TRUS biopsy. TRUS stands for transrectal ultrasound. An ultrasound probe in the rectum creates images of the prostate, and the doctor uses that ultrasound guidance during a transrectal biopsy. This approach is common and widely available, and it's usually done as an outpatient procedure. Why has it been the default for so long? Availability and workflow. Many clinics can schedule it quickly, and many clinicians are highly experienced with it. But the most important thing to understand about the transrectal route is simple anatomy. The rectum naturally contains bacteria. Because the needle passes through the rectal wall, infection prevention becomes an important part of the plan. That's why clinics often use antibiotics and specific prep steps to reduce infection risk. The goal here isn't fear. The goal is clarity. Ask your doctor what your center does to prevent infection and what symptoms after the procedure should prompt you to call immediately.
Better aiming when MRI shows a target.
MRI Fusion biopsy. MRI Fusion is a targeting upgrade. Here's the simple idea. You get an MRI first, the MRI may show suspicious areas, and during the biopsy, software helps overlay those MRI targets onto the live ultrasound view so the doctor can aim more precisely. It's like turning on a better light and aiming where it matters. Fusion targeting is especially useful when MRI shows a clear target, when a prior biopsy was negative but concern remains, or when the goal is to reduce the chance of missing a significant lesion. One important nuance. MRI-targeted biopsy does not always replace systematic sampling. Many doctors do both systematic cores to survey the prostate and targeted cores to sample MRI-identified lesions. Another nuance. MRI quality matters. The scanner, the protocol, and the experience of the reader can affect what the MRI shows. If you're getting an MRI to guide biopsy, it's reasonable to ask whether the center does a lot of prostate MRI and uses modern protocols. Now let's talk about transperineal biopsy. Transperineal refers to the route. Instead of passing through the rectum, the needle passes through the perineal skin into the prostate. Why is it discussed so much? Because avoiding the rectal route can reduce the risk of infections related to rectal bacteria exposure. That's one of the biggest reasons many centers are adopting transperineal approaches. But in the real world, Not every clinic offers transperineal biopsy. It may require different equipment, training, and workflow. Some centers use local anesthesia, others use sedation.
Transrectal
So
or
availability
transperineal,
and the patient
why?
experience can vary. So how do you choose?
Systematic,
Most men care about
targeted MRI
safety,
fusion, or
precision, comfort, and convenience, usually all at once. But you can still make the decision simpler by focusing on your priorities. If infection risk is your biggest worry, ask whether transperineal biopsy is available and whether you're a candidate. If your
What symptoms are
MRI
normal
shows a
versus urgent?
suspicious area, ask about MRI targeting or MRI fusion. If you've already had a negative biopsy, but PSA keeps rising, ask whether MRI targeting changes the strategy. And if pain or anesthesia is your worry, ask exactly what your center uses and what recovery typically looks like. Now let's clear up a few common myths. Myth: TRUS is always unsafe or outdated. Not necessarily. Many centers do TRUS biopsy with strong infection prevention protocols. The point is not to label one method good or bad, but to match the plan to your situation and your center's expertise. Myth: MRI fusion means you don't need systematic sampling. Often, doctors combine targeted and systematic sampling. Myth: a normal MRI means you're completely safe. MRI can be reassuring, but it's not a perfect all-clear test. Decisions still depend on the whole picture. Here are the 5 questions to bring to your appointment. 1. Are you recommending a transrectal route or a transperineal route, and why? 2. Will this be systematic sampling, MRI targeted sampling, or both? 3. What is your infection prevention plan for this approach? 4. What anesthesia will be used at your center?
Thank you, doctor.
5.
This plan is very helpful.
What symptoms
welcome.
afterward
Follow
are
the
normal,
instructions and we'll see
and
you
what
soon.
symptoms mean I should call immediately? If you ask those 5 questions, you'll walk out with a plan instead of guesswork. And that's the goal. Route plus targeting plus prevention steps chosen based on your situation, not based on panic. All right, here's the simple takeaway. TRUS is a common route and widely available. MRI fusion is about better aiming when MRI shows a target. Transperineal is an alternate route that may reduce infection risk depending on the center and setup. So don't walk into a biopsy like it's one single thing. Walk in with 2 questions: which route and how are we targeting? That's how you turn panic into a plan. And hey, if you're about to Google this at 2 a.m., do your browser history a favor. Close the tabs, write down the 5 questions from this video, and bring them to your appointment like a grown adult with a clipboard. Very powerful. Important disclaimer, this video is for education only and is not medical advice. I'm not your doctor, and this doesn't replace care from your clinician. Please discuss your specific situation with a qualified urologist. If this helped you feel calmer and more prepared, subscribe to Nourish today for facts over fear. And watch the next video in this series because we're tackling the biggest biopsy myths that freak people out for no reason.
Thanks for watching. Stay informed, stay calm, subscribe for calm, evidence-based health here on Nourish Today.